On this Friday night, the lengths some Canadians will go to get vaccinated.
And coming here where they're being handed out like candy.
When grabbing a jab means going south of the border. Why didn't an Ontario nursing home devastated by COVID-19 follow its own outbreak plan?
We want to prevent this happening in any other home.
A Global News investigation. Disaster in Israel. The religious festival that became a deadly stampede. The Canadian victims. And a family's anguish.
I couldn't move his arm. So then I was like shaking him. I'm Reed, wake up, Reed, wake up.
A healthy husband taken by COVID. His widow's regret.
Global National with Donna Friesen. Reporting tonight, Farah Nasser.
Good evening, and thanks for joining us. Tonight, we have some hopeful news. Though we're still in the grips of the third wave of COVID-19, there are signs public health measures and vaccines are finally bringing the numbers down. Daily case counts across the country have dropped 7% in the last week, and the vaccination campaign is about to pick up steam. Starting next week, Pfizer will be shipping over 2 million doses a week to Canada through to the end of June. That is more than double the weekly doses we received in April. And today, the federal government announced those shots will be coming from Kalamazoo, Michigan, instead of Europe. Canada faced disruptions in its vaccine campaign earlier this year after a slowdown at the Belgian production plant. Johnson & Johnson's vaccine has not been administered here in Canada yet, and there's already a hiccup. Late today, Health Canada said it's holding off on the distributing of these shots because they contain an ingredient made at a facility where a mistake was made, and 15 million doses had to be dumped. The J&J doses will be released when Health Canada is sure they're safe and effective. Right now, over 32% of Canadians have received at least one vaccine dose. That's more than 12 million people. But only 2.9% of Canadians are fully vaccinated with 2 shots. Still, some Canadians frustrated with this rollout are tired of waiting, and they're finding the vaccine elsewhere, even if it takes them out of the country. Robin Gill has our top story tonight.
Most Canadians wouldn't know where Muncie, Indiana is, but Alyssa Johnston grew up here. And 3 weeks ago, she left Toronto for her hometown to get vaccinated. She just received her second dose.
It was a little shocking coming from Canada where it's almost like the Hunger Games and trying to find a vaccine and coming here where they're being handed out like candy.
3 years ago, Natasha Freitas and her family immigrated to Canada. When they found they could get the shot in Ohio, they hit the road. Now they're hanging out in the Catskills Mountains waiting for dose 2.
Part of our motivation was the healthcare system in Canada, so it's been really somewhat ironic to be in this situation where we're going to the States for healthcare.
Many states in the U.S. are dropping their residency requirement, and there are no lineups, so anyone can walk into an American pharmacy and get a shot. This immigration lawyer based in Washington State says it's a new era of medical tourism.
It's no different than if you're coming down for elective surgery and you want to pay for it.
But the second in command at Canada's Public Health Agency is towing the line and asking Canadians to respect travel restrictions.
Stay at home, wait your turn, and I think certainly the doses are coming.
But Canada's rollout has been slow. There's the wait for the first vaccine. There's also the 4-month delay for the second dose. Natasha Freitas does feel conflicted that she's able to do this.
It's great for me, but it doesn't feel as good as it would if everybody were vaccinated.
Same goes for Alyssa Johnston.
It's one more vaccine available to a Canadian up in Toronto who needs it. I'm not taking, a vaccine that I don't need to take in Canada.
They avoided the long lineups, but there's still the 2-week quarantine when they get back. But they believe it's worth it. Robin Gill, Global News, Vancouver.
And the reason the U.S. is able to offer Canadians vaccines is because it has too much supply and not enough demand. A little later on Global National, we're going to look at some of the creative tactics being used to encourage Americans to get their shot. Ontario Premier Doug Ford is pushing the federal government for more restrictions on Canada's land border with the United States. He blames travelers for bringing in contagious new variants and says some are exploiting loopholes in federal border measures.
We will never get ahead of this virus if we can't keep these deadly new variants out of our country. The borders, land and air, they're federal jurisdiction. And I assure you, if I had the power, I would close down Pearson Airport immediately. I would shut down the land border crossings to only those who are absolutely essential.
New variants are still putting pressure on Ontario hospitals. The province is now getting help from the military, and as Eric Sorensen reports, there are some promising signs the third wave is cresting.
The military has moved into the temporary field hospital outside Sunnybrook Hospital, a sign of the stress in Toronto's healthcare system and a demonstration of 34 eager recruits from Joint Task Force Central ready to help.
When a task such as this comes up and we have the opportunity to provide support and help, my team is very excited. So pandemic, no pandemic, when we have a chance to help fellow Canadians, we're all in.
A few patients have been transferred here, none seriously ill. Doctors say they will receive the same top-notch care.
The care that we're providing inside the mobile health unit does not look any different than the care people would receive in a bricks and mortar hospital.
It's the latest response to a wave of COVID cases. Yesterday, Toronto's Michael Garron Hospital had to transfer 10 patients to other hospitals because of a looming shortage of oxygen. 5 of them transported by Orange, the province's air ambulance service. But there are signs of improvement in Ontario. 2 weeks ago, the outlook was alarming. From over 700 cases in ICUs, modelling foresaw well over 1,000 cases in May with strong or moderate lockdown measures, possibly as high as 1,500. Today, the number of COVID cases in ICUs is 883, but that is down from yesterday as numbers are leveling off, and projections now see ICU cases falling during May.
Even though the new numbers might be coming down, the load on the ICU, the load on inpatient hospital care is going to be felt for weeks to months to come.
Meantime, recent polls show dissatisfaction with the Ontario Premier's handling of the third wave. Ontario only recently agreed to pay for 3 sick days, but his own science table was blunt on whether it's enough to stop the spread of COVID variants.
No.
The Premier is pinning blame on Ottawa, saying it could do more to cover sick days, and says essential workers are getting sick in the first place from COVID variants because of Ottawa's lax border restrictions.
The variants within the workplace, Cynthia, are coming from the borders. The system is broken. All I'm asking the federal government to stop the variants from coming in. And these are deadly variants.
An end to the third wave may be coming into view, but it can't come soon enough for a premier whose political fortunes have been engulfed by it. Eric Sorensen, Global News, Toronto.
The Prime Minister rebuffed Ontario's request to strengthen measures at our land borders. Trudeau says there is a fundamental difference between someone arriving by air versus someone arriving by land.
Anyone who comes to the U.S. land border has already been tested in the U.S. in the last 3 days. Then they have to get tested again. And everyone has to quarantine for 2 weeks and do another test on day 8. We're enforcing very severe consequences for anyone breaking these rules.
Ontario's Long-Term Care COVID-19 Commission has just released a lengthy report into how the province failed these facilities during the pandemic. It blames the province for not acting fast enough despite multiple warnings about the virus, plus a number of problems that long existed before the pandemic, like underfunding, understaffing, and poor infrastructure. And it caused the coronavirus to ravage care homes. The commission also says Ontario did not learn from the SARS outbreak in 2003 and even, quote, lost the will to prioritize being prepared for a pandemic. That included not having enough PPE because the province destroyed its emergency stockpile. Just 2 days ago, Ontario's Auditor General published her own scathing findings. Our investigative team has spent months looking into what happened inside those care homes, including the worst hit in Ontario, Tendercare living in Toronto. 81 residents there died. And as Carolyn Jarvis reports, families are asking how it was able to get so bad.
Tendercare Living Centre had a plan in place in case of a COVID outbreak. It had been in writing since last spring and was verified by Toronto Public Health. The plan was to use a vacant wing of the 4th floor to isolate any residents who tested positive. This personal support worker, whose identity we've agreed to protect, says they were briefed on the plan at meetings.
They told us time and time again, in case of anything, the residents would be moved to the 4th floor.
Documents obtained by Global News state Tendercare could set up the unit the same day. But when COVID hit on December 4th, the plan wasn't put into play.
What they were doing, and I was so upset, They were moving the residents from unit to unit.
2 weeks into the outbreak, and Toronto Public Health intervened, issuing a rare order for the home to separate positive and negative residents. But by this point, 118 residents were already infected.
Toronto Health, I believe, should have acted much more aggressively as soon as they are aware of the outbreak.
The company contracted to manage Tendercare, Extendicare, one of the largest owners and operators of long-term care homes in Canada, said staff were falling ill and they didn't have the resources to open the floor.
It was pretty shocking to me that it was possible to seem so unprepared.
Dr. Kate Greenaway, who responded to a call for help on social media, says the home felt frenetic.
Certainly what I was ordering immediately was oxygen and dexamethasone. And then at some point later in that shift, one of the nurses just said, well, we don't have any more.
Any more what?
Oxygen.
They were out of oxygen.
Right. I sort of said back, I don't understand.
So without oxygen and without dexamethasone to open up those lungs.
Yeah. No, you're in trouble.
Greenaway was able to get oxygen from the nearby hospital. Tendercare says the stress on the health system in the region at the time meant that delivery of supplies, additional staff, and other support was not immediate. By the end of the outbreak on February 1st, 81 people were dead. All but 5 residents in the home of just over 200 people had been infected.
It's essential that we talk about what we saw because we want to prevent this happening in any other home.
Carolyn Jarvis, Global News, Toronto.
Ontario's premier said he'd put an iron ring around long-term care homes to protect residents from a second wave. That didn't happen. Tomorrow on The New Reality, Carolyn takes a deeper look at who is accountable. That's Saturday at 7, right here on Global. A day after launching another independent review of harassment and sexual misconduct in the military, Prime Minister Justin Trudeau acknowledged the measures his government has taken have been inadequate. The comments came as Trudeau was asked why his government is launching another investigation just 6 years after the Deschamps report, done under the previous Harper government, described the culture within the military as hostile and endemic.
Survivors continue to feel that they are not appropriately supported, continue to feel like the only thing they can do is either talk to the media or come forward anonymously. And that is a failing of the entire system.
Trudeau says his government will look to make immediate changes while former Supreme Court Justice Louise Arbour conducts her work. The Toronto Blue Jays say they're cutting all ties with Hall of Famer Roberto Alamar after a sexual misconduct investigation. The investigation was launched after an industry employee came forward with an allegation from 2014. Major League Baseball says it reviewed the findings and found Alamar had violated league policies. He's now been placed on MLB's ineligible list, and the Blue Jays say they're taking down his banner at the Rogers Centre. Alamar said in a statement today he's disappointed, surprised, and upset with the news. It was a joyful celebration that became a mass tragedy. Coming up, what went wrong at a religious festival in Israel? "45 people, including at least 2 Canadians, have been killed in a stampede in Israel. And a warning, some of the story contains disturbing images. Tens of thousands of mostly ultra-Orthodox Jews had gathered to celebrate Lag BaOmer. It was the first mass religious gathering held in Israel since the country eased its COVID-19 restrictions. Witnesses say the stampede started when a large number of people tried to exit the festival through a narrow tunnel-like passage.
It's a difficult moment, and it's going to be a difficult next couple of days.
Members of Montreal's Jewish community have confirmed the Canadian victims are 21-year-old Davi Steinmetz, as well as well-known singer Shraga Gestetner. A shot for a shot. Still ahead, creative paths to COVID immunity in the United States. The situation in India remains dire as the country struggles to deal with a surge in COVID-19 cases. India set another global record today, recording more than 385,000 new confirmed cases. In the last 24 hours, more than 3,400 people have died. Daily deaths have nearly tripled in the past 3 weeks. Hospitals are still overwhelmed and they are still struggling to deal with oxygen shortages. But India is now facing a new problem: a lack of vaccines. Several Indian states have run out of doses, forcing them to shut down mass vaccination centers. The U.S., meantime, is facing a much different problem. It has lots of vaccine supply, but not enough demand. Tens of thousands of vaccine appointments are going unfilled across the country. The number of doses administered each day in the U.S. is dropping. And as Jackson Prosco explains, that's forcing some states to get creative to convince vaccine skeptics to get the shot.
I am here at our large-scale vaccination clinic, and as you can see, we have lots of empty chairs.
For all the vaccine available to Americans, the supply of willing recipients is starting to dwindle.
This is going to be an uphill battle. I really kind of see us in this time crunch of trying to get people vaccinated before we see some of these other variants.
100 million people are now fully vaccinated. More than half the population has received at least one shot. And yet the rate of inoculation has slowed dramatically, down 25% in the last week to an average 2.5 million doses per day.
We have to get to that 75-80% of us fully vaccinated and really get this thing under control.
There's little room for error because 1/4 of Americans say they're vaccine hesitant and will not get the shot.
I do not plan on getting it unless I am forced.
To change the game, states are getting creative. In Louisiana, a Shots for Shots program is making its way through bars.
Well, the convenience is what spoke to me most today. The fact that it's literally 5 feet away from me. I work late nights. I've either just never found the time or just been too exhausted to go out.
Some NBA teams are planning to offer vaccines to fans during games. And mobile clinics are fanning out across communities to meet people where they are.
Getting as many Americans vaccinated as efficiently and equitably as possible is our path to returning to a more normal lifestyle.
The next 100 million shots will be much tougher to administer, but no less important. The U.S. still averages more than 50,000 new infections each day.
Each of us needs to look around in our communities, in our families, in our circle of friends, and ask people if they have a plan to get vaccinated.
The hope is that trusted local voices like doctors and pastors can help convince skeptics as communities do all they can to get shots into arms. Jackson Prosco, Global News, Washington.
And new real-world data shows the benefits of vaccination. A U.S. CDC study found those who were given 2 doses of either the Pfizer-BioNTech or Moderna vaccine were 94% less likely to be hospitalized than those who were not vaccinated. But the efficacy dropped to just 64% if they only had 1 shot. Researchers found no significant effectiveness for people who were less than 14 days past their first dose, highlighting that it takes time for the vaccine benefits to kick in. The findings are consistent with vaccine clinical trials.
It's the only night I didn't say I love you because I thought I would have the very next day.
But COVID killed her husband with no warning. That's next. We end tonight with a story of just how cruel COVID-19 can be. We often report on the statistics of the virus, the numbers of cases and dead. But behind each number is a person. A British Columbia woman who lost her young, healthy husband to COVID-19 is sharing her family's heartbreaking story. And as Ahmad Agahi reports, she hopes her tragedy will serve as a warning to all Canadians.
He poured everything. He poured everything into being a father.
From all the memories they've shared. Who would have known these tragic, haunting moments would be the last?
I just said, okay, good night. Ahmad, that's the only night that I didn't say I love you. It's the only night. I've said I love you every single night prior to that. It's the only night I didn't say I love you because I thought I would have the very next day.
Her husband, 46-year-old Reed Hance, who was diagnosed with COVID-19 10 days prior, had a fever, a cough. It was more comfortable for him to sleep on the couch that night, and that's where he would struggle to take his last breath.
I went over just to say good morning, and then I put my hand on his arm. When I put my hand on his arm, It was cold. And then when I tried to move his arm, I couldn't move his arm. So then I was like shaking him. I'm like, Reed, wake up, Reed, wake up. And then it wasn't until I moved his eyelids back and then I saw that he was unresponsive, so then I called 911.
What happened next was a blur, she says, until it was time to speak to her children.
I said, okay, I have something to tell you about Dad. And, right away, I don't know who was it that said it, but he said, is he dead? And I said, yes. My older one, he's 10. And he just collapsed. And he just starts crying. And I think my 8-year-old, he was sad, but I don't think he knew what to do. And he started crying because his brother was crying. And so I said, boys, do you want to come over and do you want to say goodbye? It's not scary. Daddy just looks like he's sleeping. And they both said yes. I said, okay. So I walk them over and he's still there lying peacefully. And they come in and my little guy comes over and he's just like, bye, Dad, I love you. Like, that was it. Like, just, that was okay. My older one, and if I'd known he was going to reach out, I would have stopped it. But, I didn't know what he was going to do. And he went over and he touched him to say goodbye. And then his hand reached back because, of course, he's cold and he's not moving. And now I don't know. I don't know. I gave them the right to say goodbye. And I don't know if that was the right thing to do. And
they'd called the province's hotline, but because he did not feel tightness in his chest, Reed Hance did not go to the hospital on the night of April 14th.
I'm getting that. Why didn't he go to the hospital sooner? Why didn't I take him here? Why didn't I do this? I didn't know. I worked with the symptoms that he had and what he was telling me. I don't think anybody knows the real true symptoms of COVID, especially with the variant.
2, 3. A healthy man, Hance was active, happy, and there was nothing more he loved than spending time with his family.
COVID does not discriminate. It's not just the elderly and the sick and the weak. My husband is only 46 years old. So everybody out there, you think that you're invincible, you're not.
What a brave woman you are, Melissa, speaking through your pain to warn others. That is Global National for this Friday night. I'm Farah Nasser. Tonight's Your Canada is this mallard at Toefield Park in Leduc, Alberta. We love seeing your Canada, so please keep sending your photos to viewers@globalnational.com. Thanks so much for watching. Robin Gill will be with you tomorrow. Until next time, please take care of yourselves and each other.